But it's very, very important. And we're going to talk about the big O, or orgasm. Touchy-feely kind of topic, but an important topic nonetheless when we talk about having sex and pleasurable. So ladies, let's talk about orgasm a little bit. How many ladies out there really know where the G-spot is? The G-spot has been talked about a lot, but it's an area in the upper part of the vagina, which gives us a lot of pleasure. It causes a lot of different sensations. It's equivalent maybe to the clitoris, but an orgasmic spot nonetheless. An area that doesn't always get aroused when we're having sexual intercourse. And a lot of times that's mainly because of the location. A lot of times I like to tell patients, if you think about the ceiling, it's the upper part of the vagina, closer towards the front. It's an area, if you run your fingers through your vaginal area, you can feel it. It's an area that is very stimulating. But it's an area, in most instances when you're having intercourse, is never really touched unless you're doing it doggy style or coming from the back. So it's a harder area for your partner to reach without some manual stimulation or changing your position. So what do we have out there that we can help it out a little bit? We've got something called the G-spot shot. Yeah, it really does exist. It's a way of enlarging that area. So if you think about it, if the ceiling is above us and the light is in the ceiling, if we could bring the light down a little further down towards the vagina, then what happens is that area will tend to get stimulated more, or hit or accessible. When you fill that area up, it becomes enlarged, it becomes engorged, and more than likely it's going to be the area that gets touched or aroused when you're having intercourse.
So, again, everybody, I'm going to be live for a couple of minutes, and I want you to ask her any questions that y'all have regarding the G-spot. What do we call this? The G-spot shots? How do I properly pronounce this?
It's going to be called the G-spot shot. This is actually a shot. It's an injection in that area of a substance that causes that area to be enlarged. That injection also has something in it to numb the area, because that's a very sensitive area, and I'm sure all the ladies out there are saying, oh my gosh, I don't want to have a needle stuck up there. But it does have numbing medication in it, so you shouldn't be that much uncomfortable after the initial injection. It only takes about 5 minutes. The shot lasts for about an hour. Mm-hmm. You can't have any intercourse for about 4 hours after you have it done. But afterwards, you should be able to enjoy that experience much more than you had before.
Can you tell us a little bit more about the patients that has got it done and their experience?
Well, the few patients that we have it done, first of all, any patient that you have, you're going to do it on, need to have an evaluation done. You need to do a consultation in advance, because for some women, it's not necessarily that they can't have an orgasm. Some women have other issues where they really don't have the desire to be sexually aroused. So sometimes it's multiple reasons why the orgasm doesn't occur. So first of all, you do a consultation. From that consultation, you may gather some information that says this is a patient who's a good candidate. The ones that we've done have felt that it worked. They could tell the difference in their sexual experience. So that's going to be an individual thing. Once again, it's going to require that person have an initial consultation.
What are the age range for this?
Well, in our practice, the oldest person I did on was 50. So the age range varies. People are having sex well into their 60s and 70s. So it's an option for anybody who's sexually active and feel that they're not fulfilling or getting an orgasm and they need some help.
Is this procedure covered by insurance?
This procedure is not covered by insurance.
It's not? Okay.
It is not.
And how long is this procedure?
The procedure takes about 5 minutes. The pricing on the procedure has to do with, there's a 9-month shot and there's usually a 12-month shot. The pricing on it, initially when we bring it out, we may start the first shot at a price of about $1,000. The one that lasts for a year is about $1,500.
So this procedure does wear out?
Yeah. Okay. But a year is a good time to have some constant orgasm.
Yeah, you're right. You're right.
Especially for the person who's had not one.
Right, that's true. So, what are the side effects? What are the side effects? What's your procedure?
Well, with the procedure, because of the location of where your G-spot is in the area just right underneath the bladder. Now, we haven't experienced any side effects with any kind of medication. You always have the person read through and see possible side effects. Now, the worst possible side effects, and worse is in the eyes of the beholder, is a person who has a constant orgasm. We don't want that to happen. We don't want people not to be able to sit in their chairs